the bulk of the people that I see are not doing all of the right things. Even people that have known heart disease, they're still not doing all the right things. When a patient tells me, I know my body, I know my heart, that's a patient who's being ignorant. Nobody really knows their body and knows their heart without seeing a doctor and having appropriate testing done. We have a whole gamut of testing because you can see someone like myself, I can see you and examine you, and I don't know what you have until I get your test results back. So if anybody thinks that they're healthy because of whatever reasons they have, you don't really know for sure. So without appropriate testing, you're taking a guess to think that you're fine. But a weakened heart muscle is the most common type of result of heart disease that we see. So people end up with cardiomyopathy and heart failure, and that ruins your quality of life, and it makes you more likely to have other problems within your body. So if you don't have a healthy heart, the rest of your body is truly suffering. Some symptoms are very obvious. The obvious symptoms are usually pretty late. So if someone's getting a tightness in their chest when they're exerting themselves, obviously there's something wrong. If someone's getting short of breath doing usual level activity that they used to do without any problems, obviously something's wrong. A lot of heart disease is hard to know. Some patients don't even realize that they do have heart disease. Sometimes a little skip beat could be a significant arrhythmia, and people think, oh, it's that coffee does that to me, it's nothing. A lot of patients are getting older and they think that it's part of the aging process, that they can't do this year what they could last year. So a lot of people are deniers, and mild symptoms get denied sometimes for quite some time. But the main symptoms we look for is, are you able to exert yourself and do full level activity and not have any symptoms? If you're able to do a good exercise program and do heavy daily activities without anything in the way of symptoms, you probably don't have any significant heart disease. In the field of cardiology, most things that we do are not curative. Most things that we do are fixing a problem immediately and dealing with the fact that you're at risk for having this problem occur again. So it would be great to say there was a fire, we threw water on it and the fire's out, but that's very rare. Most of the time what we fix is a fix to get you well today, knowing that you're still at risk for the same thing happening again tomorrow, next year, and years down the line. There's a whole long list of things that people can do to stay healthy regarding heart disease. We recommend truly proper diet, limiting saturated fat intake, limiting your red meat intake. Certain things are proven to be healthy for you, like oats. Going to your doctor, getting your blood pressure checked, your cholesterol checked, a routine physical exam, all of those things are very important to do as far as staying healthy. Smoking is, in this area, unfortunately, very common, and it remains very common. We've known for years that if you smoke, you're more likely to get blockages in the arteries of your heart, blockages in the arteries to your brain, the arteries to your legs. And now there's even data coming out on electronic cigarettes and all these vaping type devices not necessarily being very healthy for you. So avoiding things like cigarettes, I would avoid any type of electronic cigarette as well. Avoiding excessive alcohol, certainly illegal drugs, cocaine and those substances can give you cardiovascular disease. So doing all of what we call basic good health, avoiding all the bad stuff and eating healthy is all good for you. And a regular exercise program, mainly talking about aerobic type exercise, is good for everybody. There's a lot of misconception. I've had a few patients tell me that they didn't get vaccinated because they're worried about their heart and things like that. So the likelihood of having a significant cardiac involvement from the vaccine is very, very small. I wouldn't tell anybody to not get vaccinated because of the extremely unlikely chance that they may get some type of cardiac involvement. And a lot of what we see is an inflammation around the sac of the heart, which is generally a fairly easy treatable type of heart disease, and extremely unlikely that anybody would suffer any significant adverse effect from it other than some discomfort in their chest. COVID has caused a lot of patients, especially in the early days when we didn't have a vaccine and people were dying quite commonly. It's caused a lot of people to stay at home. Even if you called your doctor and said, I think I have COVID, your doctor said, stay at home. So if you're at home having what you think may be heart disease, a lot of patients really did stay at home. The patients that we saw were often later stage presenting, even heart attacks. Patients stayed more so at home. Now I think it's eased up a bit. Patients are coming in, I think, a little bit earlier than they were. The amount of heart disease from COVID that we see is not that tremendous. You can see almost any type of involvement of the heart muscle, and you can end up with a weak heart muscle. Fortunately, those cases are not that common. And most of the patients with COVID, from a cardiovascular standpoint, are doing fine. We have enough treatment available that even if COVID involves the heart, most patients are doing fine.